Welcome to Nurse Educators Now, a podcast brought to you by Collaborative Momentum Consulting. I'm so pleased to have David Foley back as a guest on Nurse Educators Now. Today's episode is part 2 of a 4-part series. Dr. Foley is an associate clinical professor at the Ohio State University College of Nursing, and he has a particular interest in helping undergraduate students be successful. Thank you, David, for being with us. Let's get started.
Thank you very much for having me.
My first question is, how do you intentionally build social capital for ESL students to help them feel connected, supported, and confident within the nursing program and the clinical environment?
That's an excellent question to start with, and I think the key word is intentional. Because faculty need to be very deliberate in terms of helping to create a culture that shifts from just passive inclusion to some very deliberate, structured engagement strategies for students with limited English proficiency, also known as ESL students. So social capital is defined again as the access to networks and relationships and resources that play a very critical role in student success, particularly in rigorous programs like nursing. For first and second generation students who are immigrants to this country, for example, that becomes even more critical because more than likely they have exposure to very few people in their family unit or social community who have successfully navigated such a complex educational experience. Social capital does not just organically evolve for all students. ESL learners may experience social isolation when they first come to the program because they have this fear of culture or fear of judgment or some sort of judgment that may be placed on them because they are different. So faculty can engineer opportunities for connection, starting in the classroom. Rather than stand by passively and watch students be very isolated, they can deliberately design collaborative activities where students participate with each other and then make sure that all students, as the faculty walk around and monitor the classroom, are given the chance to speak. That really helps to create a very psychologically safe learning environment where language development is normalized. And I think we need to remind ourselves that all students, whether they are ESL students or native English speakers, are really challenged by an onslaught of nursing terminology and medical terminology. It is like learning a second language. But having the sensitivity and the compassion to recognize that many of our ESL students are also struggling with English. There's different forms of expression. There's written expression, there's listening, and there's also, example, comprehending tests, having verbal conversations with both peers as well as patients in the clinical setting. So faculty really need to recognize this and help to create relationships among students and among their peers. I can think of one example I would like to share in terms of helping students to enhance their social capital. I happen to be the faculty advisor for a group called MANS, M-A-N-S, which stood for the Multicultural Association of Nursing Students. It was a group that we created at my previous academic affiliation. And it was really very interesting because it was open to all students. And we wanted all students to come to our club meetings and to really bring their best of their culture with them. And we started every semester with a networking event. And we asked students to please come and bring something that represented their culture and to bring a dish to share. And so when everybody came into this large room, first of all, we were shocked as to how many students came and the pride with which the students, especially our ESL students, brought their culture into that classroom. We intentionally socially engineered that room so that there were a series of small tables, and we wanted people to meet in small groups. And the only rule was we asked everyone to please sit with people that you had not spoken with before. Every 15 minutes, we rang a bell and we asked people to meet with new groups of people. And to see that table hopping and to see those social connections emerge right in front of our very eyes was extremely inspiring. As the students entered the room, we asked them to please place a pin on a map in the city of residence and then on the state and the country and the world. And many students were very surprised when they saw later, because we displayed these maps in our nursing display case. They were very surprised to see how many students were from the international arena who had enrolled in our School of Nursing. And it was so inspiring, and it really, you could just see, it really helped to create a lot of social connections.
Your explanation of this was very clear, and I really believe that faculty in all kinds of nursing schools will find that very helpful, certainly for ESL students, but perhaps for others as well. So thank you very much. How can nursing faculty adapt teaching methods in the classroom that better support their language comprehension without diluting the rigor of the program, which is so important?
I think that's a great question. And when I speak with faculty, that's one of the first things that comes up is we certainly don't want to make the curriculum easier. We want to make sure that we maintain academic rigor. And we do need to remember that the pot of gold at the end of the rainbow for all students is to sit at that computer and pass the NCLEX exam and move forward into practice. So adapting those teaching methods to support ESL nursing student learners requires a focus on accessibility without compromising academic standards. And the goal is not to simplify the content, but we want to make sure that language simply does not become a barrier to demonstrating competence. So faculty really can, rather than just do the typical PowerPoint and then the multiple choice midterm and final, can really use a multimodal instructional approach. And that would be presenting information not just through PowerPoints, but through visual aids and diagrams and videos, shorter written summaries that allow students to process a lot of very complex information through multiple channels. And that really aligns with cognitive load theory, which suggests that learning is enhanced when information is presented in diverse yet complementary formats. At the beginning of every lecture, it's important, I think, especially for our ESL learners, that we do clarify what the learning goals and objectives of that week's contents are. Also, to make sure that we again emphasize to all students that there is going to be a lot of new medical terminology and nursing terminology, and to normalize that and to integrate that vocabulary into teaching, including pausing to practice pronunciation and to place those terms into some very specific context, maybe through a patient care example, because that will allow all learners, not just ESL students, to really take that new terminology and give them some cognitive bridges in their mind as to how to apply that term. Active learning strategies are also very important. Techniques like think, pair, share, present some complex content and then give the students something to process and divide them up into small groups and give perhaps case-based discussions. And small group work will really help with very clear instructions and structured participation. And then having the students present can also be a real confidence builder. Assessment practices are also very important. The typical midterm and final examination is not going to be effective for our ESL learners, particularly to give faculty feedback on how all students are performing in the class. Waiting until 8 weeks into a 15-week semester to give the first assessment will really deny the faculty the opportunity to do any sort of early academic remediation or identify any opportunities to provide supportive resources to students. So it's really important that very early on, perhaps every 2 weeks, break that midterm up into maybe a series of shorter quizzes or other forms of expression, regardless of what the assignment is. It's really important for ESL learners that we look at the rubric first, because that's what you're going to be graded by, and then work backwards and then start to say, now, how can I plan my response to this question, this case study, this midterm, so that I can really have a roadmap for success? So ultimately, I think to answer your question, adapting teaching methods is more about removing unnecessary barriers to the ESL learner and preserving the complexity and the integrity of our curriculum rather than diluting rigor.
Thank you, David. The information that you had about the teaching learning strategies was something that all of us can encourage our students to do. I was particularly interested in the notion of making sure that students knew and looked at the rubric before they started their work. That's something that is important, I think, for all students. Can you talk about what strategies you found to be most effective in helping ESL students navigate communication barriers in those high stress, high pressure clinical settings while managing patient safety?
I think all of us could empathize with an ESL learner. They are taken out of sort of that very insulated environment of the didactic classroom and that very affirming environment of the nursing resource lab where they can do simulations and we can hit the pause button and sort of interrupt that simulation anytime. And now we're taking them to the clinical setting, which is real time. And there is no pause button in the clinical setting. And so students sometimes can feel enormously stressed. So helping the ESL students develop some strategies to navigate communication barriers will really help offset that and still promote learning and build confidence. The primary challenge here is going to be to avoid cognitive overload so that the students can perform well. I think that this is a really great chance to explore with the ESL learner in the clinical setting how valuable a structured communication tool such as SBAR, situation, background, assessment, and recommendation, can be particularly effective. Those types of frameworks that many native English-speaking nursing students might just gloss over are often welcomed by ESL learners because they provide a very predictable and structured format for communication and to reduce ambiguity and to really promote a very accurate exchange of information. So repeated practice in SBAR, we can even start with that in the classroom. We can introduce it in the nursing resource lab. So it's really very familiar to the ESL learner in the clinical setting. Also, pre-briefing, or what we call pre-conference, and the post-conference briefings are another key opportunity that we can promote ESL student success in the clinical setting. We can go through and review behind closed doors what the patient's diagnosis is, sit there with the student as they go through the chart to make sure that they're picking out the correct data elements and that they're forming nursing assessment priorities that are appropriate for that patient for that particular day. So in the pre-briefing, we have that opportunity to really slow down and go over, and we can even do some role playing with the student. Now, when you go into that patient's room, what's the first question that you're going to ask? And what would happen if the patient responded this way? Or what would happen if the patient responded in another way? And go over and give the students an opportunity to just sort of briefly rehearse. I've also found it very effective that I go with the student to meet the patient for the first time. And so standing there, the student really feels very well supported. Also, during clinical care, as the Joint Commission recommends, some closed loop communication techniques are also very important, such as if you don't understand something that the patient is saying, offer to repeat back to the patient what they're saying and hopefully teaching the student not to wonder, but to really be very sure that they're understanding what the patient is saying. So we want to make sure that we have a culture of psychological safety in the clinical setting. You use the word high pressure environment. Students must feel comfortable asking for clarification without fear of judgment. That's called the just culture of safety. And for our ESL learners, framing questions within the context of simple inquiry and clarification is really teaching them that asking questions is a professional responsibility and not an opportunity to be awkward. And so we really want to normalize that. So all of those strategies collectively support the ESL student in developing the communication skills that are necessary for safe clinical practice, but also allowing them to move forward with professional identity.
I really appreciate what you said about that, and you made some very important points. In my own career, I have seen students and nurses, frankly, who were perhaps not proficient in English, afraid to ask questions, even when to do so would help them to provide safe care. So thank you for that tip. David, what role does the Nursing Resource Lab or the simulation environment play in strengthening not only the clinical skills, but the language confidence for the ESL learner?
So simulation and the Nursing Resource Lab is extraordinary because it's a very safe, controlled setting for very deliberate practice. I describe it to the students as an incubator. It's this warm, affirming environment where you can really acquire skills. So we learn knowledge in the classroom, and we're going to learn skills in the Nursing Resource Lab. And then that Nursing Resource Lab is the bridge or the pathway to working with actual patients in the clinical setting. So the closest thing we have to that is that simulation, usually conducted in the Nursing Resource Lab, allows for repetition and standardization. It helps students to practice clinical scenarios multiple times. And then I've often encouraged students during open lab to come back and sort of go through the simulation again on their own using perhaps one of the low fidelity mannequins. A key advantage of simulation is the ability to integrate clinical reasoning and communication, but again, within the context of that very safe environment. Again, I say that there's no pause button in the clinical setting. There's no pause button in actual nursing practice. But within the context of a simulation, it's a great opportunity. And I've even encouraged students, raise your hand and just ask us to pause so that we can answer any questions you have, and then we can run through it again. That type of low stakes contextual learning enhances confidence and leads to enhanced competence. So with the simulation, the role of the pre-briefing and briefing are really essential components. Our ESL learners many times will struggle again with terminology, and we want to make sure that we can give them the chance to practice the pronunciation of certain terms, as well as if this was your patient, what would you be doing with this patient today? What are your nursing priorities? What sort of plan of care would you plan for this patient? And the debriefing provides an opportunity for reflection. And I often tell the students, let's ban fear from this simulation experience. Please feel free to ask anything. We want you to make sure that you feel comfortable. And faculty should definitely use the opportunity to encourage the student and make sure the students overall that the simulation and resource lab serves as that critical bridge between the classroom learning and clinical practice. Not only should it support skill development, but it should support the ESL learner in terms of how they can enhance their language development as they begin to care for actual patients.
That is really a wonderful response. Given the importance of simulation in today's world, your advice is spot on for helping us to maximize the learning activity in the simulation center. For our last question, how do you incorporate peer support or mentorship models to enhance belonging and academic success among ESL nursing students?
I think this is probably my favorite question because over the course of my career, I have been very actively involved and very intentional with creating peer support and mentorship programs for students of all kinds, but in particular, the ESL students, and many of those come to mind. So peer support and mentorship are very essential strategies for enhancing belonging and academic success for ESL students. So thoughtfully and actively creating mentorship programs and peer support programs helps them to build social capital because it helps to foster relationships and shared learning and mutual support. So one of my favorite examples is a friend of mine who was a surgeon in the former Soviet Union. And she emigrated to this country and she realized that she did not speak a word of English and would not be able to pass her medical state boards. So while she was learning English, she went and became a nursing assistant and successfully ultimately graduated as an associate degree nurse and then a baccalaureate prepared nurse, and then came and saw me, and I was her mentor when she was navigating the challenges of her nurse practitioner program. And her struggle and her journey was just so inspirational to me. I've had her come and speak to some of my students in the past. And one time when I was standing in my classroom, I looked out and I realized that there's such power from that podium. I call it the power of the podium. When I look out over a classroom and I see a student who's sitting and they're isolated or they're struggling, and it's obvious that they really have no one to turn to in terms of peer support within the program. So in this case, I had two students who were from Eastern Europe and one was from Russia. And when we had one of our MANS events, I asked my friend, I'll call her Maria, to please come in. And she came in and sat down at a table, and the students were drawn to her. And I still have a picture that I can look at, and it really inspires me until this day, that the students were hanging on to her every word. And it was almost as though they were conveying, finally, someone who understands. And right on the spot, she agreed to become their mentor. And she stayed in touch with them, and she even came to our graduation pinning ceremony. And it was just so inspirational to see how an immigrant from perhaps 10 years earlier, who was ESL, ultimately came and was very influential in terms of helping some other students succeed. So near-peer teaching is also something that we can do. Perhaps there is a peer who is one level above a student in the program, and we can ask them to come to one of our events or even exchange contact information with a new person in the program, perhaps a freshman, and ask them to stay in touch and to share tips and strategies about navigating the complexities of the nursing program. That's also been very, very effective for us. Also, alumni can come back. And sometimes the alumni are native English speakers, but they want to come back. They have a sense of purpose, and they welcome the chance to come back and work with students from all backgrounds. ESL students have really appreciated that support. So whether it's from the community of interest or alumni or near peers, actively creating opportunities for people to meet each other is so important. And lastly, I will say that regardless of where the person is from, we've had ESL students from multiple different languages and countries around the world, but just introducing them to each other and to have them form a peer network amongst themselves. And they unite with the common challenge of navigating the dual linguistic challenge of continuing to master English along with all of the nursing terminology is nothing less than very, very inspiring. So the strategies that I've described for peer support model and for mentorship models are extremely important to help to contribute to that culture of psychological safety and success that I've been describing.
Maria's story was inspiring, not only to the ESL students, but I suspect all students in your classroom. Your story highlights the importance of faculty intentionally creating opportunities for connection and support among the students for everyone. And I believe that our faculty that are listening will be able to use these strategies in their own clinical or classroom environment. So thank you very much.
Thank you for having me.
That's all the time we have for today. Thank you for tuning in to Nurse Educators Now. Please subscribe to the show and share it with a colleague. For more free nursing education content or to book a consultation, visit us at collaborativemomentum.com. We'll be back soon with more conversations to support, challenge, and inspire you.